Does cystoscopy requiring anesthesia for patients? When considering whether cystoscopy requires anesthesia, it's important to understand the procedure itself. Cystoscopy is a medical exam that allows doctors to look inside the bladder and urethra using a thin tube called a cystoscope. This procedure is commonly done to investigate issues like blood in the urine, frequent urinary tract infections, or to monitor bladder cancer. The use of anesthesia during cystoscopy can vary based on several factors. These include the type of cystoscopy being performed, the patient's specific health condition, and their individual pain tolerance. For flexible cystoscopy, which is often done in an outpatient setting, local anesthesia is typically used. This involves applying a numbing gel to the urethra before inserting the cystoscope. Most patients find this procedure to be quick and experience minimal discomfort. After the procedure, they can usually go home shortly after. On the other hand, rigid cystoscopy involves a more rigid instrument and is often performed under general or spinal anesthesia. This is especially true if the procedure is expected to be more invasive or prolonged, such as when performing certain surgeries or biopsies for bladder cancer. When it comes to anesthesia options, local anesthesia is standard for simple diagnostic cystoscopies, particularly flexible ones. The numbing gel helps reduce discomfort during the procedure. For more complex cases, such as tumor removal or biopsy, general or spinal anesthesia may be necessary. This ensures that the patient is either asleep or numb from the waist down, making the procedure more comfortable for both the patient and the surgeon. For those concerned about bladder health or undergoing evaluation for bladder cancer, cystoscopy plays a crucial role. Most diagnostic cystoscopies for bladder cancer surveillance are performed with local anesthesia. However, if the procedure involves more invasive actions, general or spinal anesthesia is often preferred to ensure patient comfort and safety. In terms of recovery, procedures done with local anesthesia generally allow for a quicker return to normal activities. Patients may experience mild discomfort or a strong urge to urinate during the procedure, but this is usually manageable. Ultimately, whether cystoscopy requires anesthesia depends on the specific needs of the patient and the complexity of the procedure. Always consult with your healthcare provider to determine the best approach for your situation. Understanding these details can help ease any concerns you may have about the procedure and its requirements.